I'm Dr. Patrick Price, the Body Detective, and today we're talking about adrenal fatigue in athletes.
I'm one of Dr. Price's martial arts students, and I would come to him sometimes rather broken or slightly injured, whether it was a result of my hardcore training or maybe just not being as disciplined in my lifestyle as far as sleeping enough, taking the best care of myself, eating good food, things like that. And coming to Dr. Price, he would show me a different way how to take care of my mind and my body, and the results would be instantaneous. I'm really grateful for that. Not only would I all of a sudden be walking normal again, I just would feel more energy, a clarity of my mind, a better understanding of how to take the best care of myself, but ultimately how to facilitate the best results, how to maintain my engine, if you will. And the results really just speak for yourself. And I would come back just knowing that whatever he tells me that I should do, I would just do it with no questions asked. Now that also includes the liver flush, of course the adjustments to various parts of my spine and my body as a whole, tore some ligaments in my knee, he helped me with that. And whatever challenges, physical challenges that I might have, they were short-lived. And I can certainly attribute that to Dr. Price and his insight and his years of experience and knowledge coming from so many different directions. And he puts it all together in a very easy to comprehend format. And he spells it out for you in paper format and text format so you can follow his list of instructions. And I can safely say that physically I'm a better person for it. I feel stronger, I feel more energetic, and increased clarity of my mind, and especially considering that the root of that for myself and how I came to know Dr. Price was through martial arts. And so that includes an elevated level of discipline just to get through my challenges, but also make my outlandish goals, my far-fetched goals, my goals that were off in the distant future, they became more of a reality sooner. And I'm forever grateful. If you're weighed down by stress, by physical pain, physical preoccupation, some kind of physical limitation, there are so many facets of it that stem from your personal life, your personal preoccupations, your emotional concerns, your emotional baggage, whatever it might be, and how it manifests in some kind of physical pain. You would want to come to Dr. Price. He can really just fix all that for you and make the preoccupation, the unnecessary weight on your mind, on your body, and your spirit. Dr. Price would help to create a clearer path to a place in your life and in your body where you just feel good all the way around. And I know, because I've seen it from other people and also speaking for myself, that you would know in your heart that he really has helped you. And the instructions that he gave you were actually the truth. And I can safely say, Dr. Price is the truth.
Hello, this is Dr. Patrick Price, the Body Detective. And I'm here today with Chris. Chris is a martial artist, and you know, me being a martial artist, I love working with martial artists. Chris has been at it for a while, but he's having a few issues with his body. And what does every athlete want? He wants 100% performance from his body. So this is more of a performance tune-up. So those of you out there who are athletes, you're runners, joggers, you play soccer, whatever event you use, and you want your body to be in full function, this one is for you, because one thing that will kill an athlete's performance more than anything else is getting a muscle cramp. Not just a muscle cramp, but having adrenal fatigue, and some of you have heard that. I'm going to show you today a typical case of what you see the body do when it's in stress. Not that he has any stress in his life at all, like none of us have, right? But everybody has some kind of mental stress somewhere. This is America. We have stress, guys. But your body handles it and processes it differently. So let's check Chris out, guys. Go face down. All right, so when he's face down, we check the hamstrings. The hamstrings have to do with your colon muscles. Remember, every organ or gland has a section it goes to. I turn his heel, I hold it strong, and he locks it quite well. He turns it here well. But when I point those toes up, look what happens. He has no power. That muscle just gives out. That's an injury waiting to happen. You know, how can a professional athlete who's top form, top endurance, they're in great shape, how do they strain or hurt a muscle? It's because their adrenals are fatigued. And so what happens is the calves, the gastro, and the soleus, the one right after that, these muscles would get fatigued and get cramped and tight. Now, not even testing his other hamstrings, I'm going to go straight to his other area. Hold it strong, and look what happens. No power whatsoever. Now, if he had only one leg showing up, just one leg was weak, that would be something neurological, something more function on the opposite side of the body even. But when you have both of them, both of these, he can't hold either one of them. That's an organ or a gland, guys. Okay, let this down. So go and turn over for us. So athletes, pay attention. That was your that's your calves. Your calves you need for jumping, for springing, for lateral movements. Very important muscles of the body. And if you want those muscles turned on 100%, I'm going to show you a little bit about the body. Now the other muscles are the sartorius, the longest muscle in the body. Hold it strong. You see he can't quite keep a contraction. Yeah. Let his leg let it go down. Good. Hold the heel. And look at it. Both sides. Why? Because the sartorius muscles are also muscles that go to the adrenals. So what other areas do we have? If I turn straighten his leg out all the way and I grab the heel, these are going to test the adductor muscles. Hold that strong. Hold that strong. And as you see, he doesn't have much there. So the adductors are like your muscles here where you're riding horses. You're contracting to hold on. These are adrenal muscles. What else? Turn the toes in, and you're going to work this little pes anserinus, they call it. This little area goes all the way into a bone where it attaches. This is a long, thin muscle called the gracilis. Hold the shoulders. What's he got here? This caput. Now, when someone has this many things going on, basically all his adrenal muscles are being affected right now. So if he goes to train, there's a good chance he can get a trauma or an injury. So you'll get an injury because with one muscle underworking, other muscles have to work harder. They have to adapt. So what we want to do is we want to make sure when he goes out to go perform his art, to do what he does, what he loves best, that he is 100%. So what are the things you need for the body? You need a product that gives you support for the adrenal glands. One I like is DSF by NutriWest, a great adrenal product. Magnesium, the body usually is deficient. We urinate out the magnesium under stress. And you need minerals. Minerals from life. Those are three of my go-tos for athletes. Always giving them the minerals that they need to the body and give them a supplement specific for their organ or gland. So where do we go first? Well, the adrenal glands sit right here in the back of the body. Where your kidneys are, this little gland sits on top of that kidney. It looks like a walnut. So we're going to ask his body which side we need to go to. Okay, so I'm going to put his hand right in the back where the adrenal gland is. If it turns on the muscles. So from here, I'm going to retest that area. It comes on. Let it go. I'm going to go to the other side, testing the, let this fall, testing that sartorius muscle. Hold it strong, and we'll see it locks. So right away, you see things coming on that we're not on. Hold it strong, and there goes his adductor muscles turning on. So we know definitely this right side is the area where kinesiology has shown us where it is. There, like I said before, guys, there's many forms of kinesiology. And it's just a matter of if a person, like a particular practitioner, wants to learn more details about the body, they can use the kinesiology. Now, not everybody has to go to someone who does this, or does a practitioner need to be successful to have this in his pocket. But I can always tell you, this worked for me greatly. So no matter what anyone believes about kinesiology, it's all about your beliefs, right? It has worked quite well for me and many others over the years. And so I use it every day in my practice. So we know now this right adrenal gland is the key to turning the muscles on in the body. This is not an idea that people usually follow, and it's not really a simple thought. This takes things a little more detailed. So as he touches the gland, hold it strong. We're going to see there's a vascular connection probably to his head again. There it is. Okay. So we've seen in other videos that these little bitty capillaries, these little areas, these little small little arteries are into the scalp, need to work on them. And craniosacral is a good therapy to use. But I'm going right down where his suture lines come together on his skull. You'll notice these little areas burn. Of course, being a martial artist, we get hit in the head a lot. I'm sure he's been hit in the head quite a bit. Then we retest the muscles. Hold it strong. As you see, locking, right? Good, solid. Let this go down. Hold it strong. Strong. And he's good and strong with that area. But now let's test the others. We'll turn his leg all the way out. Keep the leg straight. Lock the knee out. Hold it strong. Okay, now that adductor still does not come on, so that's another region we need to look. Turn this over. The hiatus gracilis. That doesn't come on. All right. So let's see if maybe that's the other side. Turn his foot in, hold it strong. Okay, make a fist right there. Okay, doesn't do it there either. Let that one go. Put the fist under. Fist. Okay, turn his foot over. Strong. There it goes. Now, turn this one over, hold it strong. Oh, lock your knee out straight. You don't want them to cheat. You want to keep the muscle locked. There. Now. So positive and negative, as many doctors that train with this says positive simply means it's like a positive negative current. You're changing the charge. So now he has his hand in a different position. And it's going to take us to a different region. Okay, let this go. So now what we're seeing is the blood flow. Those huge arteries that come down this way. This is called a percussor. We go right down to the arteries where they come down. The iliac artery, the femoral artery. Now, why does this make such a difference? Well, arteries are muscular in texture as far as they can contract and they can relax, so they can become restricted. And so using a percussor helps opening up these regions, helps the muscle relax. It's in the tissue of the artery. And plus you have the fascia and you have the contraction of the other muscles that's been going on for a while because of the adrenal fatigue. Okay? In Thailand, they have a technique where they shut off most of the femoral arteries with their hands. And they touch the arteries and put pressures to open them back up again. Now with his hand out, turn his leg over, keep your knee straight, hold it strong. And you'll see his leg come back on. Just by opening up some blood flow here in the major arteries. Turn this one over, hold it strong. You see it's fully functional again. So now we see the basic adrenal muscles have come back on again, and these muscles are holding the contraction. Hold it strong. And I check his spine. Good, let's sit up. And like a good chiropractor should do, you're always checking what? The upper cervical. The atlas again. Let's let it go. Let it relax there. The actual adjustment is actually the easier part of what's going on. Yeah, good. Good, let him lay back. And now we test the big muscles just to make sure he's on. There he is. Okay guys, he's ready for action. I'm Dr. Patrick Price, the Body Detective, and today we're talking about adrenal fatigue in athletes. We'll see you in the next session. You take care.